Hello, M3s. I'm so sorry that I can't be there with you tonight. I did prepare a short video for you that is on Step 2 CK Prep. All right, I'm going to cover in this short video just what to expect on the exam, things that you can do to prepare, what you might use for study resources, study methods, and then we're going to follow this by the M4 panel. Okay, what do you already know about Step 2? Well, I know that students tend to score better than on step one. They take less time to study and they're more confident. So, knowing that you have been studying all along through your shelf exams this year puts you in a pretty good position. I've shared this stat before. 53% of students in Phoenix in the last 2 years scored 250 or higher. Some were even in the 260s. I think we pulled down a 270. So everybody's capable of having a successful step two exam. All right, what is on step 2 CK? It's intended to test your clinical acumen. So a lot of what's the next best step. You're going to have to think. No more of the first order questions like you had on step one, nothing like step one. You're going to use everything, though, that you've learned so far to do well on this test. It's divided into two categories, disease category and physician task. So you'll see normal growth and development, general principles of care, and then individual organ systems. It's a one-day exam. There's 8 60-minute blocks, and it's administered in 9 hours. All right, system specifications here. You can see all the list here of everything that is covered. By the way, on the screen before, I had a link that sends you to the USMLE content outline with sample questions. So you can also hit that link up and you can see some of the things are a little more heavily covered than others. This last category, legal and ethical issues and professionalism, we will send you some specific resources to prepare for those questions. But again, you've been living some of this stuff, and so those should come pretty naturally. Don't overthink those questions. Okay, physician task and the competencies. Again, it's going to be what you've seen and how you've been tested on the shelf exams. And so heavy on the diagnosis here and labs and diagnostics. And then, of course, we know it's predominantly medicine, right? You've heard this 2/3 of the test is medicine, followed by surgery. You do need to know some peds, OB-GYN, and psych. When is the best time to take it? Well, I think the earlier the better. And I think Dr. Piamonte would say the same thing. You do need to take it by July 1st. And just a reminder, you log into your NBME account to register, and then Creighton Omaha is going to send you a permit. You'll get an email from Kelly. Then you'll go on to Prometric and you'll find your location and then you'll sign up. All right. Some books that you might want to consider, especially if you need to take a deeper dive and maybe you didn't do so well on surgery and you want to take a look, or maybe you had IM first. These are some of the recommended books from past students. I do have some of those in my office. They're older editions, but they're certainly free. You can help yourself to those. Okay, QBanks. Of course, we recommend UWorld and Amboss. Amboss is boss, I like to say. Some of these other ones, if you haven't been using them, I wouldn't start now. I would stick to probably UWorld and Amboss, but these were some of the other recommended from other past students. NBME, you're all going to take the CCSSA as part of the guided review. That'll give you a baseline. You'll be able to go in and look at the answers that you got correct and incorrect, look at answer explanations. This will be a nice tool for you to use to help inform your study plan. So you'll be taking one of those, and then if you didn't take all your practice tests for shelf exams, those NBMEs, you could certainly take those as well. Then closer to the exam, I would put in your study plan, taking the other two NBMEs. And so we've got forms 9, 10, and 11. They are $60 each, which and they have 200 items, 50 items per 1 hour, 15-minute block. So I would recommend taking it in standard mode so you're timed and it's simulating the real thing versus self-paced. Um, you could stack two on top of each other and kind of simulate a full day test, and then using those answer explanations. High yield. Okay, some other resources: online med-ed videos, Divine Intervention, Curbsiders, Step Up to Medicine, Master the Boards, and then again, timed mode is helpful. Okay, as it pertains to test taking, we all have some degree of anxiety when we take tests. We know that. Expect the vignettes to be longer. And try not to scan for information. You wouldn't do that if a patient walked into the room. You would sit and listen attentively, build kind of the systematically what you're learning, and kind of arrive at a differential. And then you can always use this method. I've told students to use a sticky note and put it in front of uh, on the computer so you can't see the answers, and challenge yourself to try to come up with the answer. That's when you're studying. Now, when you're on the test, if you do uh, arrive at two answers that might be correct, try to tease out why an answer wouldn't be correct and eliminate the one that's the most uh, wrong. Okay, full circle. Hopefully everybody's still using this technique and it's pretty high yield. Again, if we are asked a question and we're asked the diagnosis, we don't stop there. We tease out everything else. We look at the pharmacology, the prognosis, the management, the differential. What are the symptoms? When you do that and you go full circle, you teach yourself a whole bunch more about that particular question that you were asked, and then you're going to see that question because they recycle these vignettes and they're going to ask something else and you'll already know the answer. This really is tried and true. This is a true email from a student that I got last year. And, they're saying they wanted to share this good news. I helped them through their struggles. Yay. And they ended up scoring in the 90th percentile on a certain shelf, the best they've ever done. A lot of it was because they went deeper with each question and used the full circle. So there you go, testimonial. In addition, keep in mind your make it stick techniques, right? Active retrieval, self-testing as you learn, connecting everything that you know, spaced repetition, quizzing yourself on a interval schedule, interleaving, mixing things up, and of course, embracing difficulty. Okay, regarding your study plan, repetition is everything. You've seen Ebbinghaus. I'm sure the forgetting curve shows that after one repetition, you might retain 50% of the information. And then after two, it gets a little bit higher. It's not till the fourth repetition where you're really maintaining at least 90% of the information. So that lends to having a good study plan where you start with what is most challenging for you so you have time to repeat and quiz yourself over time on that material. Speaking of study plans, everybody's is going to be different, right? There's a magic Google spreadsheet. I don't know if everyone has seen that. If you haven't, you can take a look at that. And there's some other plans that I have. Guided review might help you. I know UWorld and Amboss have built-in plans. I'm happy to work with anyone and review your study plan and talk about it. Okay, what we learned from the past students. These are some wonderful students of the class of 2022, and they were out hiking in Sedona after they took step 2. They said they used UWorld and Amboss mostly. Now, 60% of the students the past couple years studied between 3 and 5 weeks, so that's pretty key. 30% studied a little bit longer. If you need a little bit longer, don't go over 8 weeks. I don't know about the other 10%. Maybe they didn't study at all. Um, Practice tests, 70% use both the NBME and the UWorld self-assessments. And I think there's a free 120 as well. Most of them on average completed at least 4 practice tests. The top resources: Amboss, UWorld, Anki throughout, and BME self-assessments. And then hindsight, take it earlier, incorporate more Amboss and Anki. Couple more tips. It's a long one. Wish I had scheduled days off. I burned out toward the end and was less productive. Take 2 practice tests. I think we were talking about this. Simulate the real thing. I wish I spent more time on rotations. I took it earlier in the year. That I took earlier in the year. I was surprised by how much I had forgotten. Oh, I took the test in Tempe. The center was great. Take all your breaks. Go outside. Yes. Definitely bring lunch and snacks. And then don't study the day before. Studying for this test is way different compared to step one. So make sure to see your friends, talk to your family, and continue working out. Okay, I had to throw this in. This is my daughter's new puppy, and her name is Millie. She likes to watch football and she likes to wear a little puffer vest outside in the snow. Isn't she cute? I knew you would like it. All right, last, I am going to turn it over to Dr. Piemonte and the panel. Thank you, Talia, Eddie, Alex, Christina, Cece, and Jesse. And students, feel free to ask them anything that's on your mind. All right, thanks so much. And again, happy to meet with anyone to talk over step 2CK or anything else that's on your mind. Thanks. Bye.